Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Renal stones, and we are looking at the treatment. So here in renal stones treatment, first is the indications. So indications of the conservative management. So this includes the stone size up to the 5 mm. Then it is a non-dilated, it is the ureter. Then comes the stone located at the lower third of the ureter. Next is the progressive downward movement of the repeated scans. The principle is to prevent the supersaturation, and to prevent the supersaturation as well as the crystallization. So prevent the supersaturation, crystallization by the dilution of the urine. So management will be by the plenty of fluids. And by plenty of fluids, it is about 4 to 6 liters per day. And then you have a 4 mm stone. So 4 mm stone, you take 4 liters of water, and then the stone can be excreted within the 4 weeks. Next is alkalinization. Alkalinization is our acidification of urine for 4 weeks. So what is the surgical innovation? The surgical innovation, you have ESWL, extracorporeal shockwave lithotripsy, that is useful in case of 85% of the cases. The PCNL, that is a percutaneous nephrolithotomy. Then you have the URS. URS stands for the ureteroscopy, and then there is that is about in 15% of the cases. Then comes the LSS, that is a laparoscopic stone surgery. It is not commonly preferred, as well as the OSS, that is open stone surgery. It is indicated in case of specific cases. Then we have the ESWL. ESWL stands for the extracorporeal shockwave lithotripsy. So what is the gold standard here? The gold standard here is that it includes the Darnier unmodified HM3. Then comes the complications. So what are the complications of this? It includes a Steen strace, and it is the accumulation of the stone fragments in the proximal ureter. Then you have the hematoma in the kidney. Then comes the increase in risk of the UTI and the increased risk of the extrasystoles. And there is also stones that cannot be broken by the ESWL. So what are the stones which cannot be broken by ESWL? So this includes the brushite, then the hydroxyapatite, as well as the cysteine and the calcium oxalate monohydrate. Now, what are the contraindications? So the stones which cannot be broken down will be the BHC2, that is a brushite, the hydroxyapatite, the cysteine, as well as the calcium oxalate monohydrate. So this will be the first one. Next is, what are the contraindications of ESWL? The contraindications is that it includes the absolute contraindications in case of pregnancy, in case of bleeding disorders, pacemakers, UTI, controlled STN, orthopedic abnormalities, as well as renal failure, aneurysms. The relative contraindications is various factors that should be carefully considered. Then is the PCNL, that is a percutaneous nephrolithotomy. So this includes a tract is created in the kidney via the abdominal skin, and then it is then a nephrolithotomy is performed. For PCN, the posterior approach is used, and there are 2 posterior approaches which is followed. That is the posterior pelvic approach, and next is the posterior calcial approach. So the indication is there is a size of stone that is greater. So greater than 2 centimeter is the size of stone. This is nothing but the distal obstruction. And then comes the UTI. It is a hard stone, that is a BHC2. So they include, there is a lower calcium stone, that is a staghorn calculi. Now what are the complications? Complication is the most common complication will include the bleeding, and the most common injured organ is nothing but the pleura, and this is followed by the colon, and it is followed by the spleen. Next is the URS. URS stands for the ureteroscopy. These indications depend on the location and the size of the stones. So the most common complication, it is a ureteric perforation. The intercorporeal lithotripsy. So intercorporeal lithotripsy, there are basically 4 types, and that includes the electro-hydraulic, then the ultrasonic, as well as the ballistic and the laser. The EHL is mainly used for the bladder stones. Next is the Holmium gazer. The whole mag laser is commonly used in the renal stones, and it is a BPH, that is a benign prostatic hyperplasia. What is the management of the renal stones? The management of the renal stone is that it includes the management is the stone size of greater than 2 centimeters. So if it is greater than 2 centimeters, you go for the PCNL, or in case if it is greater than if the heart stones is in case of heart stones, you do the BHC 2, you do the PCNL. Next is the Staghorn calculi, which can be done. So there is a Staghorn calculi. Next is so in case of Staghorn calculi, there is a sandwich technique. There is a sandwich. So sandwich technique is basically the PCNL plus the ESWL. So you have this, and then the stone size up to 2 centimeters. So if it is up to 2 centimeters, you do the ESWL. Now management of the ureteric stone, it depends on the location of the size of the stone. And size of the stone, the upper and middle are 1/3 of the ureter. So it is upper and the middle 1/3, and this is of the ureter. Now we saw the upper and the middle 1/3 of the ureter, and the size up to 1 centimeters. So size up to 1 centimeters is where you do the ESWL, and this is greater than that of the URS. And then when the size is greater than 1 centimeters, you do the URS. Now what is the lower 1/3? So in case of the lower 1/3, we go for the no use of shock waves, no use of the shock waves for the lower 1/3 of the ureter. There is no use of shock waves, as URS is typically employed. To learn and grow daily like this, please do subscribe.